Do 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 do. Yeah, for fun. Why not? I said let's start with the easy one. Almost. Next week we'll finish everything. Okay, MT massage therapy techniques lecture for the lower leg and the foot. Isn't this a cool picture?
It is.
Thank you, internet.
AI generated.
No, it's just each. It's just each angle or each plane.
I mean, I
3 feet. Wait, is there? Making sure the toes are 1, 2. It might be. Look, this.
There's only 4 toes. Damn it.
Darn it. Yeah, and the foot does not look like that. That does not.
Like how Canius is all wrong.
This is all wrong. It's got ribs. This foot has ribs. Whatever.
Muscular.
Yeah. All right. We're going to learn to palpate bony structures around the foot and the lower leg today, like tib, fib, malleolis. Identify certain muscles and tendons of the region. Learn about some conditions that are common, and so on. Glad I didn't hear it. All right. Key bony landmarks of the lower leg. There's not a lot. We have the tibia and the fibula, right? And then the far end, closest to the ankle, is where you have your malleoli. So the tibia is medial malleolus, and your lateral malleolus is actually the end of your fibula. When we're talking about the shin, we're talking about the anterior border of the tibia. So the shin is your tibia. Yeah, but this is a reminder.
Okay.
Reminder so that we can palpate things later. Because we're going to keep drilling you guys with this. All right, the feet. Remember, you have all those tarsal bones. So your calcaneus, again, is your heel bone. Your talus is your ankle dome. That's what it says. Bone. Navicular is kind of where your medial arch is. Your cuboid is the lateral part of your foot. Right over here, the brown. Then you have your metatarsal heads. So the bones have the heads, the shaft, right?
Tiger cubs drink chocolate milk.
Yeah.
I don't know the word.
Chocolate milk.
Oh wait, how's a C? I know you said milk with a C, but let's go with chocolate milk.
Chocolate's better than regular.
Chocolate milk's way better.
Then we have our phalanges, so tarsals, metatarsals, phalanges, right? And then don't forget, under the great toe, you have those tiny 2 little bones, the sesamoid bones, which I actually circled in this picture here. Let's zoom for fun.
Sesamoid bone.
Sesamoid. And if you feel each other's feet today, you can try to palpate that. She's like, I don't want to feel feet. You're feeling feet. All right. So again, our palpation basics is kind of the same for every part of the body. You're going to start gentle, right? Gently try to feel around for tendons and joints. You can start doing range of motion with the ankle to try to see if something pulls a little bit different. Compare both sides. We're looking for tenderness, swelling, and the alignment with both sides. Because some people have had multiple ankle injuries or feet injuries or whatever, and you can actually tell a big difference. So that can also affect how they walk, right? Which can work its way up the chain and affect their back and so on. So palpate during movement, like I said, and then when you're doing that, you can identify some tendons under tension and resisted motions as well. So it's really easy to see the tendons in like the feet and the hands because it's just thinner there, less meaty muscles. Let's talk about the key muscles in your anterior and the side lateral view of your leg. The main one here that you're going to hear me talk about a lot is your tibialis anterior, because that just kind of hugs that tibia. Then we have something called our extensor hallucis longus. This actually extends your big toe. Then you have your extensor digitorum longus. This actually extends the rest of the toes, right? And those are kind of all in that front and lateral part of the leg. And you'll see in the books we have the fibularis muscle, but it's also called the peroneus. So those are interchangeable because that's what science likes to do to us. And those peroneus muscles are mainly stabilizers for the ankle, and they help evert the foot. So you'll see the tibialis anterior right along here. And there's actually some retinaculum, crossing over all those tendons to kind of keep them tied together like a cable cord. Talk about the back of the leg. So this is the superficial muscles. I know soleus is actually deeper to the gastroc, but we have more muscles that are even deeper, like the tibialis posterior. Okay. So, again, remember the gastroc is your main calf muscle. Right under it, about the same shape, is your soleus. Then you have your Achilles tendon. All those calf muscles, remember, come down and form the Achilles or the calcaneal tendon. Here's the deep ones. So we strip away those two muscles, soleus and gastrocnemius, and then we got these bad boys. So the main one back here is your tibialis posterior. So you have your anterior along the shin bone, and now we have our posterior that is deep to the gastroc, right? You're like, I don't know. You tell me. On this side, so the front had your extensors. The back is going to have your flexors for your toe, right? Because if I were to pull everything this way, my toes would curl down. If I were to pull things from the front, my toes would curl up, right? And then they say palpation tip, Tom, Dick, and Harry behind the medial malleolus. So all these kind of run down to the medial part of the leg and form Tom, as in tibialis posterior, Dick, as in digitorum longus, and Harry, as in helicis longus. Oh, shush. No brevises here. My gosh. Everyone's always like, how's your class? I'm like, they have quite the personality. Say never a dull moment. All right, let's dive in. We're doing the diving in. I gotta stop the diving in.
It sounds like a podcast.
Let's dive in.
Smash that like button.
Let's jump in to the Achilles tendon. So here's a picture to kind of go over what I was talking about a little bit better yesterday. With the Achilles tendon, how it actually wraps, connects onto the heel, and then you have all this fascia right here that gets inflamed, and this is your plantar fasciitis. See, the foot doesn't have ribs. All right, so the Achilles tendon is the strongest tendon in the body. Oh, even stronger. I'm shocked that it's stronger than the IT band. But if you think about it, we're using our feet for everything mobile. Walking, running, stabilizing, right? Common injuries to the Achilles would be tendinitis, tendinosis, a rupture, so a complete tear. Whew. All that can happen to the Achilles. A little more about plantar fasciitis for funsies. I feel like this is in the wrong spot, but it's fine. Because this is supposed to go under feet. I have it twice. Whatever, let's talk about it twice, because why the heck not? So this is that thick connective tissue, a thick band of it that runs below the foot on the plantar side. It helps with supporting your arches. It absorbs the impact. It can become inflamed due to overuse, poor footwear, or tight calves. So I thought this was a cool, more anatomical looking picture than just like this cute guy over here. You're cute, animated. But it's just all this thick band. So that's why it's important when we're dealing with plantar fasciitis to hit that heel real good, hit the calves real good, and then really get very detailed footwork to kind of free up that fascia a little bit. Does anybody have plantar fasciitis in this room right now?
Not right now, used to.
Does anybody have foot pain in this room right now?
Depends on the day.
Depends on the day. Can I use you as my foot demo today? She's like, no. If not, I'll use somebody else. I want somebody who has an issue.
I have an issue. So I do this.
What?
It hurts in the back.
It hurts in the back? It's you. You're my victim.
Kiki.
I know, I would wear those shoes. All right, injury awareness. When looking for red flags, we're going to look for somebody who says they have sharp pain. Maybe we'll find swelling or heat or, red in the area. That's what inflammation does, remember? If you don't know that by now, there's the door. Loss of function is a big one. Sorry. Contributing factors. Overuse is the big culprit here. Improper biomechanics. Insufficient warm-up when you're doing activities or sports or working out. When do we avoid massage? During any acute inflammation. If we suspect a tear or something more serious going on, or if they have severe pain. Hold up. Other teacher.
We can beat her for that class if you want. Tell her to jump here.
No, she's asking about the final. All right. Common lower leg conditions. Night class doesn't get treats. We get treats and potlucks. Treats. I'm going to keep saying it like that. Treats. All right. Common lower leg conditions. Here's your shin splints. Here's your shin splints.
Those are shin splints?
No, not this picture.
Those are POTS.
No, those are fractures.
POTS fractures, because both bones are broken.
Whew, that looks painful.
Although that one looks like one of the spiraling ones that I can't remember the name of. But
I don't know. No, I'm talking about shin splints is the first one. So this is also called medial tibial stress syndrome. All right, so they have a tenderness in the tibial border and a tight tib posterior. Compartment syndrome. I actually don't have an extra slide for that, but we learned about that a lot of times. Remember, that happens post-surgical. All right, so firm, tender muscle compartments. Sometimes it's really severe and we just don't want to work on them. Right? Achilles tendonitis or ruptures. Again, pain along the tendon, swelling near the heel a lot of times. Sometimes it's just a nice big fat swollen heel. Fibular fractures. This is actually a fracture of the tibia here in multiple places. Ouch. And then we have stress fractures that can happen on either bone. Here's some shin splints. So you can actually have the shin splints on the anterior and the posterior side. Bo, that's why he has shin splints. The pressure. I actually saw somebody walking the other day, and I'm like, no, running. They were running on the streets. On this Belmont Street. I forgot what Hammond Road. There it is. And the way his foot was going, I was like, oh my God. He needs a massage. I'm about to pull over, pick him up, and drop him off, man.
the guy that came in last night, was it?
No. I was about to massage that poor kid.
I know.
What was his name? Ricardo?
Yeah, Ricardo, he needed a massage.
Yeah, I was about to just drop what I was doing and be like, get on my table. But
Okay.
some random student came here.
He's like, how do I sign up?
And he's like, I'm in a lot of pain. How do I do this? I said, in January.
January. We should have like a student day. We should do a student day.
We should do a student day. We do that the first week. It's like anybody can get, while you guys get used to it. But anyhow, bring it back. Shin splints cause usually from overuse, poor footwear, running on hard surfaces, so overuse, right? So this would be a diffuse shin pain, tenderness along the tibia typically. So when dealing with shin splints, a lot of times, any of these things, we're going to start off with light effleurage to warm up the area. And then you can get in and do deep stripping to all those muscles in the whole leg, honestly, but right along the shin. So we can hit the, it's actually a lot harder to get to the tibialis posterior than the anterior, right? You can actually feel the meaty muscle there. So we would do deep stripping, some myofascial release. Avoid anything if they have acute inflammation, all right? But stuff like that, it actually responds well to also muscle energy techniques with the foot, all right? I love the head and neck, but lately here I've been loving when people are having issues with like their lower leg. I don't know why. It's like this new fun thing. I'm like, yes, you have plantar fasciitis? Awesome. Achilles tendonitis or tendinosis. What's the difference? Okay, so the cause is, again, overloading tendon, tight calves, increase in training. So maybe the person went from 0 to 100 real quick. Maybe they're training for a marathon or something like that. So the tendinosis is where you have the tiny tears, and the tendonitis is where you have inflammation. This would cause stiffness or burning pain. Sometimes the tendon will become thickened because it's repairing those tears. Remember, scar tissue is a thing. So what we would do here, most of this is going to be the same stuff we're doing. Stretching. You guys are cut off.
Toes. They're making fun of the thing that says no toes. There's no toes. There's no
on the
phalanges.
diagrams.
Well, I'll be darned. This person, maybe they had an amputation.
But they still have their skin. I'm just saying.
The skin is actually just phantom skin. It's the aura of the foot that was there. My God, these pictures, I need to pay more attention. Oh my God. So massage, we're going to do cross fiber friction along the tendon, along the gastroc, soleus. Avoid aggressive work if it's acute. Again, I would also, since it's happening on the Achilles, I would do the foot real good. Right? Calf strains. So you have strains and sprains. All right, here's a strain here and a calf tear. So a calf strain would be a sudden explosive movement. The cause, sorry, I don't know what I'm reading. Overstretching, tight fatigued calves, poor warm up, right? Sudden increase in activity. It's kind of the same, right? Most of these are overuse. I think all of them are overuse unless there's a fracture, which could be just an injury. Symptoms: sharp pain in the calf, difficulty bearing weight or pushing off of the foot. You might notice bruising or swelling or feel heat from the area. A lot of times people say they feel like they were kicked in the calf. I've not heard that, but that's what the internet says. Massage. We want to avoid, again, anything in the acute stage, right? Gentle effleurage. Maybe start with some myofascial release on the calves. Cross fiber friction along any scar tissue if we find it. And then there's the pin and strip technique. So what we're doing is we're stripping an area and we can pin the certain muscle and strip and stretch. So like the pin and stretch that I've done on the neck. So I'll show you guys some stuff like that today on the foot with Kiki's messed up foot. Stretching, either assisted or passive. Assisted is great, especially if maybe they can't do that full stretch by themselves, and then you add that extra oof at the end, because that's what happens, the oof. Heat is good for this. Heat is good anyhow. If somebody's dealing with these issues, you can suggest, unless they're in an acute stage, right? Remember, you don't want heat on acute injuries. You might suggest they put some heat on their legs before their session, just warm up the tissue for you. Hot stones works well with this because it's heating the tissue up. All right, moving on. Stress fractures. This is caused from overuse or repetitive impact, a sudden increase in the training load, poor footwear. You get the point, right? Low bone density or nutritional deficit could cause this too. Symptoms: tenderness in a very specific location. They call it pencil point pain. Sometime the pain improves with rest and it worsens with activity. You might notice swelling, bruising, whatnot. So for massage is contraindicated over the fracture. Remember, work only on the surrounding structures if they're already cleared by their doctor. We're not working on fractures. Okay.
Comes up rolling in with a cast on.
Oh, that happens all the time.
Okay.
Or boots.
Yeah, or a boot.
A lot of times what I do is I do lymphatic work above the area and then light lymphatic work below the area to kind of move that fluid.
And then just proceed with the massage.
Proceed with the massage. Because if they're walking different, imagine how their other leg is taking the load, how their hips and back are feeling. So you can still proceed with the massage, just locally avoid the fracture. So here it says the last thing, work on kinetic chain, hips, glutes, thighs, low back, other leg. Ankle injuries. So we have sprains. It can happen in any of the tendons in your ankle. So you can evert your foot and roll it that way. You can invert your foot and roll it that way. So there's different tendons depending on which sprain you do. I actually have that in the next slide, I think. Yeah. So the lateral ankle sprain, the lateral side, you're going to have tenderness over those lateral ligaments, which is right here. Right? Medial sprain, tenderness over the deltoid. There is a deltoid in the leg. Ligaments. High ankle sprain. This is pain above the ankle joint with palpation. You're not going to have a lot of high ankle sprains. Most of them are going to be the anterior, the ATFL sprain, most common. And then you have tarsal tunnel. You had carpal tunnel. Well, there is a thing called tarsal tunnel. I've not worked on anyone yet with tarsal tunnel, but it's just fun to say, tarsal tunnel. So most of the sprains are happening with an inversion, right? That's the easiest way to do it. Your foot rolls out from under you and you roll your ankle. Next thing you know, you have a sprained ankle. But you can also, like I said, evert. Remember, eversion has a shorter degree of movement. So imagine how that one feels. We all know the cause of sprained ankles, all right? Yeah, step in anything. You can do it walking on straight sidewalk. I can at least. Or you can have weak peroneal muscles, all right, or overstretched ligaments that might cause things to not be so tight, and then you just bloop, right? Symptoms: bruising, swelling around the ankle, hard time bearing weight. You're going to have instability or reduced range of motion. Somebody sprains their ankle, avoid massage on that area. Tell them to go to the doctor, for the love of God. Start with effleurage above. You might not be able to do the foot at all because of any little movement while working on the foot might trigger pain in the ankle. So I would just work above it, all right? Joint mobilization, if they can handle it, very gently. See which movement causes pain so that you can tell them to tell their doctor that, right? Not that the doctor's not going to figure this out. Once they're healed up, you can proceed with normal work, do stripping on the legs, get the foot real good, and try to get that range of motion back. Here's tarsal tunnel. So remember, you have medial nerve. What's the word? The medial nerve's getting compressed, right? Well, now we have compression of the tibial nerve, the posterior tibial nerve, right? Behind the medial malleolus. So when you have this going on, you're going to kind of feel that pain in the medial side of your ankle. This can be caused from flat feet or excessive pronations. That's why it's important to kind of fix your gait if you're walking kind of funny, or get insoles or something like that. Swelling due to overuse, again. Space occupying lesions. So this is your cysts or your bone spurs, right? You might have tight retinaculum in that area. But remember, cysts and all that, if you're having a structural issue going on like that, most of the time doctors will leave it alone unless it's causing injury or causing pain. So if the client has a cyst there and it now is starting to cause issues, that's when they might want to, get a specialist and maybe get some surgery, get that cyst removed. So burning and tingling inside the ankle. They might have numbness in their arch because it's affecting a nerve, right? So you're going to have all those nerve pains, numbness, tingling, burning. That usually gets worse with standing and walking. And then weakness sometimes for extreme cases in something called the intrinsic foot muscles. So those are all the tiny little, the main foot muscles that are only affecting the feet, right? So massage for this, as long as we're not in the acute stage, you can proceed with gentle range of motion, cross fiber friction, trigger point work on the foot and the calf. Common foot conditions, bum, 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 bum. Here's that picture, right back at you. So you got your plantar fasciitis, metatarsalalgia, so pain in the metatarsal heads. You can have inflammation of those sesamoid bones, so sesamoiditis. Stress fractures again in the metatarsals, so not only in the tib and fib, you can have stress fractures in any of those bones. And bunions, remember that affects here's a picture here, that affects that great toe. Now, as long as, we're going to go back just to that list. As long as the person isn't having extreme pain with the bunions, you can still work on them. You might just have to avoid the actual bunion because there's too much tenderness there.
What makes up a bunion? I want to know. Is it bone?
Yeah.
What's happening here? Okay.
Yeah, and it just kind of starts shifting that whole metatarsal.
Isn't it stress forces that drives it?
Yeah.
And it causes like arthritic reactions.
Yeah. Ouch. Yeah, like I have heels. I have a client that no matter what, she still comes in wearing freaking heels. She looks adorable all the time. But her feet are a mess, and she comes in just for feet work. I'm like, girl. She's like, she goes, flats are ugly.
How about wedges?
Is she like 4'5" or something? She just tiny little thing.
Yeah, you probably know who she is. I'll tell you later. I'm not allowed to say, actually. HIPAA! All right, plantar fasciitis, we already did that. All right.
Trauma to the big toe joint can also lead to the development of a bunion.
Yep. Sports massage techniques. So a lot of the techniques we're going to be using, again, with any massage, warm it up with effleurage, right? This is where we might do our pin and strip motions, and I'll show you how to do that, and we can actually do some dorsiflexion and plantar flexion while working on different parts of the lower leg. Cross fiber friction along the Achilles, right? You can do cross fiber friction along anything as long as you know what direction the muscle's going, and you're going to do the transverse version of that. Myofascial spreading of the plantar fascia. So myofascial stuff, you don't have to go in real deep. You don't have to be aggressive on the foot. You can still get an effective treatment with lighter touch. Okay, so for the people who aren't deep tissue queens in this class, so far everyone's really good with pressure. But anyhow, you can still learn maybe a different modality like myofascial release and still be very effective. Associated range of motion. So again, assisted. So what am I talking about? Assisted range of motion. So you guys all know what that is by now. So the client's helping. And then we can do trigger point work Look for trigger points. Ask the client, are you feeling this in any other spot other than where I'm pushing? People actually have a lot of trigger points in the tibialis anterior, I find often. And it's pretty tender to work on. It kind of burns. Yeah, it burns. Red flags for palpation. Remember, severe pain with light palpation is a no-go. Acute swelling or like a deformity going on in the foot. Maybe a new deformity because they might already have a deformity. Loss of ability to bear weight. Numbness or tingling in the foot or toes. If you suspect a fracture or a tendon rupture, refer out. Look at them. They're having fun, these students.
Have more fun.
So with your partner today, you're going to partner up. I want you to, it says locate the tibial tuberosity. Remember that little bone where your quad's attached to? Then I want you guys to find, I mean, these are all easy structures to find. The malleoli on each ankle, the calcaneus, which is the heel. If you can't find these 4 things, y'all need to work on your palpation skills. Look at me just putting you guys down. Just kidding. I want you guys to gently palpate the gastroc and go down all the way to the Achilles, and you can feel the shape of it. Palpate the tib anterior during dorsiflexion and plantar flexion to see what happens to that muscle during different movements. Identify plantar fascia and where it might attach on the heel. And then I want you guys to compare both sides of your person's foot. Cool.